The CDC has released new guidelines around masking, and conservative commentator Ben Shapiro is pissed off. He tweeted this out saying, "I got the vaccine, my wife got the vaccine, my parents got the vaccine, my small kids are small kids. None of us are masking in our own effing home, and the CDC with its ever-changing pseudoscientific nonsense can shove it." Wow. Ben Shapiro destroying the CDC with facts and logic, except for the fact that this is not a fact or logical. This is not the actual CDC policy. No one is telling you to wear your mask in your home. This is how conservative commentators, especially Ben Shapiro, try and, destroy arguments. They create things that don't exist and then destroy those arguments that aren't even being argued. So this is a straw man argument, just complete bullshit. But let me get to the actual masking policy, their actual guidelines. And I do have a criticism of the CDC based in science, which I'll get to in a second here. First, I want to show you the actual masking policy. So no, wearing masks in homes is not a policy. This is the new update. To maximize protection from the Delta variant and prevent possibly spreading it to others, wear a mask indoors in public if you are in an area of substantial or high transmission. This is off the CDC website. The reason they are saying this is because the new Delta variant is incredibly contagious. Even if you have both vaccines, you can still get COVID-19. Your symptoms won't be as strong as somebody who's unvaccinated, but you can still get it and potentially spread it to other people who are unvaccinated. That is why they are recommending wearing masks indoors in public spaces. And as I'll get to, there is a real criticism here of the CDC and how they've handled this. But before I get to that, let me first show you the White House's response to this change.
Why did the president say, if you've been fully vaccinated, you no longer need to wear a mask? Let me repeat, if you are fully vaccinated, you no longer need to wear a mask, if it was possible that that was going to turn out not to be true.
Well, Peter, I think we're all dealing with an evolving virus where there's no playbook and no historic precedent. And what the American people should feel confident in is that we are going to continue to be guided by science, look at public health data in order to provide new guidance if it's needed to save lives, protect the American people. When he made those comments back in May, we were dealing with a very different strain of the virus than we are today. And Delta is more transmissible. It's spreading much more quickly. It was nearly non-existent in the United States back in May.
All right, so there's White House Press Secretary Jen Psaki defending the new change and discussing how it's true that back in May they said that there could potentially be a change. Here is this quote here from CDC Director Dr. Walensky on May 13th of this year, saying, "If things get worse, there is always a chance we may need to make change to these recommendations." That's around masking. And yes, that's true. Here's the issue. Back when they first told people not to wear masks in public spaces indoors who were vaccinated, you had epidemiologists, hundreds of epidemiologists come out and say that is the wrong policy. So you have here, this is a piece from May 13th saying hundreds of epidemiologists expected mask wearing in public for at least a year. The CDC said Thursday that vaccinated Americans no longer needed masks in most places. Other disease experts recently had a different message, that masks were necessary in public. This is because the science showed us that if you are vaccinated, yes, you'll be protected largely by the symptoms. If you contract COVID-19, first of all, it's harder to get COVID-19 if you are vaccinated. But even if you are vaccinated or even if you get COVID-19 while vaccinated, you still have, it basically for most people is like a mild flu. But you can still spread it to other people who may be unvaccinated. This is why it was important for people, even vaccinated people, to wear masks in public spaces indoors so that you don't potentially get the virus and spread it to somebody else who's unvaccinated. But the CDC, as a way to try and encourage more people to get vaccinated, removed this idea using the unmasking as sort of a carrot to encourage people to get the vaccine, and are now seeing the results of that. So you have here an obvious spike in the U.S. in COVID-19, daily new confirmed COVID-19 cases per million people. So you see here slow growth over the past month. Actually, I'll extend out this just so we can see a little clearer. But so cases were down, are now spiking back up in the U.S. Meanwhile, UK is coming over, fighting this Delta variant. And I mean, apart from Israel, you're not really seeing a similar spike right now, at least in terms of the countries I listed here. Of course, there are many countries, the vast majority of which don't actually have access to the vaccines, which is a whole separate issue with the TRIPS waiver that I've discussed a number of times. But just based on these countries, the U.S. is seeing a spike. And if you look at the vaccination rates, the U.S. is out of the 5 countries I listed there, the lowest. So Canada right now doing really well at about 71% have at least one shot, with 57% having 2. UK similar numbers, but then it goes down. The U.S. not even at 50% having both shots. So even though Americans had access to the vaccine before anybody else in the entire world, they are not leading the world in the vaccination rate. And that's because of misinformation, largely from conservative media, conservative commentators like Ben Shapiro. I'm not saying Ben Shapiro is the one spreading vaccine misinformation, but many like him in that space are spreading vaccine misinformation, like Tucker Carlson, for example, on Fox News every night. So because of that, you have a large group of people who are now overly skeptical of the vaccine, even though they don't understand how privileged they are to be able to have access to the vaccine well before anybody else in the entire world. I mean, I covered at the beginning of the year, Canada had a massive spike in COVID-19. And this was during a time when Americans were getting vaccinated and their cases were coming down. And that's because Canada doesn't have its own vaccine producer like they did back in the 80s. So they had to rely on, Pfizer, on Moderna, on others in investing in those vaccines. And basically Canada, got the vaccines after Americans largely got theirs in terms of the shipments. So we had to wait for Americans to get vaccinated before we were able to get vaccinated. And now, because there is less vaccine misinformation in Canada, at least in mainstream press, more Canadians are willing to get the vaccine, less are skeptical of it. But of course, you have a lot of propaganda in the U.S. that are convincing people otherwise. And looking at the transmission rates, this is why people are being encouraged to wear masks indoors, even if you're vaccinated. High transmission in red. Almost like half the country here is in red, and I'll get to actual data in a second. But substantial, moderate, a lot here, a lot of places here where the vaccine or where COVID's still being spread. This from CNN, nearly half, 46% of U.S. counties currently have high transmission and 17% have substantial transmission, according to data from the CDC as of Tuesday morning. So this is why people are being encouraged to wear masks indoors. Last thing here from Jonathan Lapook, MD, said, I just spoke with CDC director. New data shows Delta variant is much more contagious than previous forms of COVID-19. That's why CDC is now recommending that in areas of substantial transmission, people should mask in public indoor settings. So there you go. It really is, if you think about it, a minor change. We're talking about being indoors in a public setting in areas that have high transmission rates. So this is still, to be honest, Canada, we are still masking up indoors, even though we have right now, our cases are incredibly low. We are increasing our vaccination rate well above where Americans are right now. Yet we are still wearing masks for the most part indoors, as I think we should be. But here you have the CDC basically saying, if you're not in a high transmission area, then it's perfectly okay to not wear a mask in public indoors, which I would disagree with, and epidemiologists, I think, would also disagree with. But the CDC policy here really isn't all that strict. So for someone like Ben Shapiro to come out and say, I can't believe, oh my God, they're making us wear masks indoors, our kids, it's all just complete nonsense. So understand, a lot of the time when conservatives try it, and if it sounds like they make a great point, like it may sound like here to people who don't know the actual policy, look into what they're actually talking about. And in many cases, especially in Ben Shapiro's case, you'll see that he just formed a straw man argument to try and make himself look smart when clearly he's just not being honest.